Mental health. It's the root of all of us, whether it be what grounds us or what sets us apart, whether it will be our structure or what puts us on edge. It is in all reality the thing that determines our very being. Hi, my name is Isabella Gilmartin, and I'm a human service major. But after I finish my associates, I'm going to go on to get my bachelor's and my master's in social work. And I'd like to work towards becoming a licensed independent social worker. I would like to eventually begin counseling and psychotherapy. Mental health and mental disorders are such a large part of our world, whether it be the bizarre or the ordinary. They are all around us, even when we are not aware. I have always had a fascination with mental disorders. When I was a child, my mother worked as an emergency room nurse that housed a padded cell for the drunks or mentally ill people in order to keep them from harming themselves. I would sit and wait for her to get off work so that we could leave for gymnastics practice, and I would watch the men and women bounce off the walls, and I would always wonder why. I have spent many hours researching mental illnesses, just in an attempt to learn all that I can. There are mental disorders all around us that people suffer from, so very often no one even knows. From things like depression, that plague far too many people, or something such as schizophrenia, which is somewhat less common, but still a tragedy to those inflicted and their families. For there are things that are hidden from everyone, other than the victim, such as body dysmorphic disorder. Depression is something that affects so many people. It hides in the darkness, casting shadows over that person. Depression is an overwhelming feeling of sadness. It makes simply getting out of bed a horrible ordeal. It can leave a person feeling undeniable sadness. The Mayo Clinic states that people will suffer from depression at one point or another in their lives, and although it may only happen once, or for a brief period of time, it is more common for it to be in multiple episodes, which can last days, or months, or for much longer. Sadly, some people never truly make it out of depression. Instead, they have increased thoughts of death, which can eventually lead to that person taking their own life. The tests for depression are varied. There is no true medical test in which can determine the illness that they have. Instead, they go by physical exams to ensure that something else is not causing the depression. They do, however, draw blood to check the thyroid to make sure that's not the cause. After ruling out everything else physical, they will do a psychological exam to see if that person is suffering from depression. Each person is different on the treatment that they require, but medications and psychotherapy can be huge factors in helping a patient to overcome depression. Every person is different, and every treatment plan has to be different. It may take time, patience, and understanding from those suffering and their families, but it can be overcome. Schizophrenia is a disorder that often presents itself in early adolescence, but it can occur later on in life, or in even more rare cases, it can occur in very young children. A long while back, I saw a television show about a young girl who presented with schizophrenia. It presents with paranoia, hallucinations, and an alternate view of reality. The little girl, her name is Janny. She suffers with childhood schizophrenia. Her parents believed that her imagination was the cause, but it turned out to be what her doctors described as one of the very worst cases of schizophrenia. She has imaginary animals that even tell her to harm people, and has even led her parents to fear their small child. Her demons are as strong as any adult who suffers from schizophrenia. Helpguide.org states that no test for schizophrenia is truly known. Instead, they use tests very similar to depression, medical tests to ensure that something else is not the cause, and they ask questions to the patients and the relatives to determine the family history and the background to see if something of that sort could cause something else. Just recently, I was with a friend's cousin and speaking to her, and although you would never know it in 1,000 years, she is actually schizophrenic. She has no symptoms, odd habits, or signs that would make me believe she was schizophrenic. She remains on medication at all times, and her outlook is quite good. They use medication, psychotherapy, and a strong supporting system to help cope with this disorder. There is no cure, but each day they work towards finding that cure. Body dysmorphic disorder, or BDD, is a disorder that affects the mind as well. Each person can find themselves unhappy with their body or hair or skin, at least from time to time. But these people instead worry for hours on end about those things. It causes them to miss work or school or even social functions because of their constant worry about how people see them, when in reality, their minor so-called flaws are hardly noticed by the outside world. But to them, they are the entire world. This disorder is not something easy to live with. Trained clinicians are the only ones that can diagnose BDD. But according to the Anxiety and Depression Association of America, because this disorder is so secret, the only way that it can be diagnosed is if the person tells the doctor his or her concerns with their own body. This disorder is treated with cognitive behavioral therapy and antidepressants. All mental disorders are hard to live with, but most are able to be overcome. Each person and each sickness require time, support, and understanding in order to help the victim. Mental illness is all around us. It surrounds our world and affects so many people, even though it is so invisible to the outside eye. It can affect almost anyone at any time, but it can most often be overcome with time.